KEEL app's a free download from Office Furniture Source. Dr. Frank Welch is the medical director of the state immunization program. Hey, Dr. Frank, how are you today?
Good morning.
We've got another local school closed because of the flu, North Caddo Elementary and Middle School. I know you're hearing about these cases all around the state. This is pretty bad, huh?
This is the worst I've seen it in 20 years. Kind of the way we rank that is the number of healthcare providers that are being visited for flu-like illness. One time, about 5 years ago, I saw it above 8% just for 1 week. We have been above 10% for 5 weeks now.
Why is that?
You know, it's this particular combination of strains. We've got some really nasty bugs out there. The one we keep hearing most about is that H3N2. Mm-hmm. That is the majority of the cases we have. It makes people sicker, it keeps people sicker longer, and it really tends to spread. So it really is an aggressive flu season.
So I see the news story. We have the news story this morning that Governor Edwards, free flu shots for everybody in Louisiana. Is this the same one that Erin and I, that we got about, 6 weeks ago or so? Or is the flu that is just knocking everybody on their, really hitting everybody?
Booties.
Yeah. Is this sort of a morphed into something else flu shot too?
No, if you have gotten your flu shot, it is the same flu shot. We've discovered that the flu shot is fairly well matched to all of the strains going around, and especially well matched to a couple of them. So this is the same flu shot. If you've already gotten one, you don't need another.
When Erin mentioned a couple at the beginning of the conversation about the school up here being closed, when these guys go into the schools to fumigate or to disinfect, I mean, is it sort of like what's the Dustin Hoffman movie? I can't think of the name of it, where the guys are in the hazmat suits and
Ebola?
What exactly do they do?
They're actually just taking, industrial strength cleaners like Lysol and wiping down pretty much every frequently touched surface. The problem with the flu is it really can stay alive on hard surfaces and even some porous surfaces for up to 12 to 18 hours. So you really got to give it a while and a good wipe down to make sure that there's no flu germs still left on it. You can imagine when we cough into our hands, and then you walk over and you open a door. So it's really important to disinfect those surfaces. And at those schools, remember, it's not just the kids. Some of those schools are closing because too many teachers are out.
Dr. Frank Welch, FW, we called him, up around these parts. Sorry about that, Doc. Nobody calls you that, I know.
My mother calls me that.
Oh, good. Well, good.
F-dub downtown.
FW.
Why are so many dying? That's where I'm like, we hear about the flu, but now we're hearing about people that are dying, children to, elderly. What's going on with that?
Well, there's two things that can happen. The first thing is sort of the classic thing we think about the flu that gets a hold of people who have other medical problems, heart problems or lung problems or diabetes or elderly or very young. Sometimes the flu is just so powerful that it weakens those people and causes those other health problems to really rise to the surface, and they die of things like pneumonia maybe a month or two later. And that's why we don't typically hear of flu deaths in real time, because it takes a month or two or three to make people really sick or, unfortunately, make them die. The other situation that we have is people who are young and healthy, when they get the flu, sometimes their immune system has way too aggressive a response. And unfortunately, their immune system plays a huge role in making them die. And that's typically what we're seeing during flu season. A healthy young person whose immune system basically attacks itself trying to get rid of this, and that's why they pass away. And it's really terrible, and it's a horrible situation, just like every death from any disease. Believe it or not, we expect to see, by the end of the season, more than 700 to 800 deaths in Louisiana from the flu. It's really terrible.
A lot of us, Doc, we wait and we wait. We put off going to the doctor. When should we go to the doctor when we're exhibiting what kind of symptoms?
Well, people always ask me sort of, what's the difference? I think I had the flu, but I'm not sure. Well, remember what a cold does or a regular virus. It kind of creeps through your body, meaning you get a tickly nose or a sore throat or your eyes start to hurt or you kind of just don't feel well. Then over the next few days, it kind of walks through your body. You can feel it in your nose and then your throat, and then you get a cough or your stomach is upset. Kind of walks through you over the course of 5 to 6 days. That is not the flu. The flu hits you like a freight train. You're fine today. You're fine at lunch. At 2 o'clock, you feel like you just can't do anything. You have full body muscle aches. You have eye pain. You really feel terrible. And the classic thing, especially in adults, is a fever. So what I want those people to do, if you get sick relatively quickly, I want you to go home, separate yourself from other people, and then call your doctor. Your doctor will let you know whether an antiviral medicine is appropriate for you. In some people, it can shorten the duration of illness, and especially those people who are at risk for other things happening, it can really minimize those other effects. Now, some people really do need to go call 911. For example, we've heard those stories about people who have been to the hospital and then have come home and gotten worse. Remember, if your breathing is really labored, if you have a really high fever, if you're really dehydrated, or if you have chest pain, make sure you stay in contact with your doctor or the hospital. They will let you know if a hospital visit is appropriate. Remember, we don't want just anyone who doesn't feel well going to the hospital or urgent care. You can actually spread the flu that way. Best thing to do is call your doctor.
I'm going to use a word that's going to get a rise out of Erin because she doesn't know exactly what it means. Prophylaxis.
Whoa.
See, what can someone do to avoid, to prevent, to take precautions against getting this disease?
Okay, so what happens is sometimes when somebody very seriously gets ill with the flu and they're prescribed an antiviral medicine, sometimes your doctor will prescribe what we call prophylaxis, which is an antiviral medicine for people around that person in the household who are not sick yet. And that is to prevent them from getting the flu. It is not appropriate for everyone. Again, your doctor is going to decide that. But really, for example, if someone got the flu and they have a relative who lives with them who has heart disease or lung disease, we may decide to give that person Tamiflu anyway, even though they're not sick, to hopefully make it so they don't get sick.
And at the end of the day, does it really help if, people make fun of me here because my rule is I don't touch myself above the neck without washing my hands first. Is that a pretty good idea?
That is a fantastic idea. Remember that the flu spreads from person to person. It's a respiratory disease. When we cough, we're often taught to cough into our sleeve, but people cough into their hands or sneeze in a tissue or something and leave that. Then you go shake someone else's hand, or you touch your eye, your nose, your face during the day and then shake someone else's hand. It's a very efficient way for the flu to transmit. So make sure to wash your hands a lot.
When can you go back? I've heard 24 hours after the fever's gone now, and also 48 hours. Which one's accurate?
Really, we think 24 hours, but there's a little caveat there. What you want is your fever to be gone without the use of fever-reducing medicines like Tylenol or ibuprofen. So if you haven't had a fever for 24 hours, we're pretty sure you're not contagious anymore.